Okay. Good morning, everyone. I do want to start by just thanking everyone who's here today. You're all part of an amazing community that takes action every day to reduce gun violence. And I want to ask that everybody recognize the community folks that are standing behind me who have dedicated their lives to building peace in LA. I know that many of you have personal stories about loss and heartache, and I want you to know how sorry I am, and I'm extending all of our wishes for healing and peace. I do applaud your efforts for taking your stories and then showing up with courage to lead efforts to protect all of our loved ones in our communities from senseless actions that rob us of the very strengths that bind us together. I'm also grateful to the state and local leaders, some of who are here with us today, but who have also joined this movement for justice and peace. Today is day 2 of Public Health Week, and we're able to mark a huge step forward in our efforts to improve gun safety across LA County. And I want to take a moment to express my deep appreciation to the many partners who have made it possible for us to have the largest gun lock distribution program in county's history. I want to start by appreciating the Board of Supervisors for their leadership, their support of the gun lock distribution program, and for actually appropriating the money it takes to make this possible. And a special thanks to the Office of Supervisor Janice Hahn, and I believe her deputies are with us today, Julia Mockridge and Kyla Coates. So if Kyla and Julia are here, if they could. They're amazing, and we can't do this work without the support of the supervisors and their talented staff. I also want to thank Andrea Welsing, who's the director of the Office of Violence Prevention. Andrea, can you yes, you'll hear from her. And I want to thank the entire OVP team, Office of Violence Prevention team, if they could all just stand up so that people can recognize you. They work impressively to bring partnerships together with our community leaders and our community organizations so that, again, we have an opportunity to build the kind of society we all want to live in. I want to give a special shout out to Patty Hernandez. Patty, can you put your hand up? Patty's the health educator who's leading the gun lock distribution program, and it's a huge, huge task. I also want to give some big shout outs to some very special people who are joining us today. I'm really grateful that Rudy Nunez and Mia Porter are here with us today. They're going to share their personal stories with gun violence in an effort to, again, help us all see not only how important this work is, about how every single person makes a difference. I also want to give, I want you to all join me in giving huge appreciations to Carlos Benavides. Carlos, where is Carlos? Carlos. I mean, I consider Carlos one of my dearest friends. I met him when I first started working here. He's an amazing artist. I want to note that I have a much coveted piece of his work hanging in my office. But more importantly, Carlos has taught me just about everything I know about how to really work with people who have experienced limitations on their physical abilities and how to be a partner in the truest sense of the word by allowing the people who know the most to take the lead and then figuring out how the rest of us get to support them. So please, everybody join me. Carlos, amazing person. I know he's central
here, I want to acknowledge that we're in the Carlos Benavides Amphitheater. That's how inspirational, courageous, and skilled Carlos has been in bringing us together in these efforts, really, again, to build a just society. I also want to give a big shout out to Juan and the Rancho Violence Prevention and Recovery team. So Juan, I don't know where Juan is. These men are amazing. If you don't know them and their work, I would ask that you take a moment to find them, learn about what they're doing here. They really connect people who have experienced a violent event with services and support, and help them rebuild their lives. And again, I think it takes enormous courage to be able to do that work. So I want to thank that entire team, and let's give them another round of applause. So I'm super glad they're here today. And of course, there's no way we're able to distribute all of these gun locks without the support of the amazing Department of Health Services staff. So I first want to thank Arias Limbaga. Is Arias? I didn't see him here yet, but I do want to thank him. I think he'll come. But he's the CEO of Rancho Los Amigos. He has an amazing team that helped us be here today. I know Dr. Jordan is here. He's the Chief Medical Officer. Dr. Jordan, maybe raise your hand. So let's just thank the entire team. Maybe they can all stand up so we can just see the entire Rancho team that's here with us today. Could the Rancho team just stand up? Because I don't know all of you or your names, but and I'm not just thanking them because they're here with us. Every day, they're taking care of people who desperately need their support, and they do it in a manner that's respectful and honors the best that we all can be. Their jobs are hard. I appreciate that they're taking time out to help us, again, build a more just society where we have an opportunity to work together to prevent senseless acts of violence. I also want to recognize Dr. Scott, who I'll be introducing in a minute. He's the Associate Chief Medical Officer and the Chair of Physical Medicine and the Rehabilitation Department here at Rancho. And he's going to join us to share some experience about working with gun violence survivors. Is Dr. Tyne here? Sharon here? Oh, I didn't. Yay, Sharon. Okay. So, Dr. Tyne is the Director of Pediatrics at the Department of Health Services, and she's just, since I got here, she's been a leader in this movement to really protect children from violence. So I'm so grateful she's here today, and that we'll get to hear from her as well. I want to thank Benjamin Obando. Benjamin, can you stand up? Where's Benjamin? Okay. Again, like some unhung heroes here. Just a big shout out to you and Rochessa Washington, because you welcomed us and you helped make today happen. And there's just a lot of work in making today happen. There are 6 DHS facilities that are going to serve as gun safety lock distribution points for patients and for restaurants. And I want to appreciate the teams at each of the medical facilities that will be participating in this distribution. We have the MLK Junior Medical Center at Medical Center. We have Harbor UCLA. We have the High Desert Regional Health Center. We have LA General. We have all of you where we are today. We have all of you, and then we have Rancho Los Amigos where we are today. There are also these very important community-based advocacy groups that are working with residents to make sure that residents know the importance of gun safety and where they can pick up their locks. Moms Demand Action, Hope and Heal Fund, Everytown for Gun Safety, Be Smart, Bullet Points Project, the Brady Campaign, the Giffords Law Center, and Women Against Gun Violence. Can we give all those groups a huge round of applause? Well, I'm really proud to be standing here today with this amazing group of leaders and organizations. I'm also very sad. In Los Angeles County, a child is injured or killed by a firearm every 30 hours. In 2022, more than 300 residents in LA County died by gun suicide, and 510 residents died after being shot by someone with a gun. The evidence is also clear that a woman who's experienced domestic violence is 5 times more likely to be murdered by her abuser if they have access to a gun. Far too many families have experienced the terrible pain of losing a child, parent, or sibling because guns were readily available in the home, loaded and unlocked. And far too many people are living with serious injuries because of gun violence. Lives are lost when a child points a loaded firearm at another child and pulls the trigger. Lives are also lost when, in a moment of personal crisis, an adult had immediate access to a loaded gun. As a community, reducing gun violence does not only mean supporting legislation to ban certain kinds of weapons or measures asking for background checks. Those steps are vitally important, but there's more we can do because we need to acknowledge that with over 400 million guns circulating in the United States, gun safety measures are going to be critical to reducing gun violence. Beginning this week, the Department of Public Health, through their Office of Violence Prevention and our partners, will be distributing more than 60,000 cable gun locks, free with no questions asked. These will be at the 6 Department of Health Services medical facilities across the county and by request through our website, which is www.lockedandunloaded.org. Later this year, our gun locks are also going to be distributed at the county libraries. This gun safety initiative is going to go a long way towards helping children and adults, our families, our friends, our neighbors safe from gun violence. If guns inside the home are locked and unloaded, it reduces the possibility that a child will get killed or hurt in a tragic accident. It keeps the person in crisis from having immediate access to loaded weapons. And it makes it that much more difficult for burglars to seize firearms, often for the purposes of committing violent crimes. So once again, I thank you all for this extraordinary partnership as we continue to work together to make sure our children and families can live in a safer and more peaceful LA County. With that, I want to now introduce Dr. Thine, the Vice Chair of the Department of Pediatrics, the Chief of Pediatrics at Olive View UCLA Medical Center, and the Director of Pediatrics for the LA County Department of Health Services. She's a board-certified pediatrician with leadership experience in clinical operations, medical education, and clinical care for children and youth. Dr. Thine is leading efforts across this county and nationally for protecting children, and I'm grateful for her partnership. Come on up, Sharon.
It's great to be here on this beautiful sunny day. Thank you all for coming and thank you for the opportunity to speak to you. I am really, really grateful to be part of this amazing county initiative, working with during Public Health Week with the launch of LA County's Gun Safety Initiative. In my role as Director of Pediatrics across health services, I see kids every day and I talk about kids every day, but kids are part of families. And in the families that they live in, they can come in all shapes and sizes. We have many children in the foster system. We have children living with blended families, extended families, and we have children living on their own. It's an amazing constituency that I get to focus on, these kids. But the truth is the surroundings that they exist in are also important. And I am so proud that LA County has chosen to focus on the safety of our children and the environments they live in. And I'm really excited that we will soon be distributing gun locks in our clinics specifically in our pediatrics clinics, but also in other settings, so that we can help people stay safe. As a primary care provider, my goals are to support the health of children. We provide vaccines, we encourage healthy lifestyles like running and getting outside, and we also partner to manage medical conditions and developmental challenges. But we also help families and children respond to trauma, and trauma, as you know, is everywhere. There's no bigger childhood trauma than experiencing loss of life or injury from a firearm. And it is our collective duty as Angelenos to ensure that our households are safe. As we emerge from the pandemic, thank you, finally, our families are working to close educational gaps, to catch up on health visits, and to support children in increasingly violent situations. More than 10% of households in LA County report having a gun, and far more than 10% of households have children. And these children may not always fully understand the dangers associated with having firearms in their homes. Securing firearms in homes is an evidence-based approach to reducing accidental injury and death, and it is particularly important in households where children are present. Locked firearms decrease self-inflicted injuries from firearms by 78% and reduce unintentional firearm injuries by 85%. Those are huge numbers. LA County's gun safety initiative just makes good sense. Through community education, which is part of this program, and through offering free gun locks, no questions asked. So free gun locks and education, no questions asked, have the potential to reduce firearm deaths and injury across our county, and particularly among children. Pediatric providers already provide gun safety education in our clinics as part of our routine checkups. Every pediatric provider should be doing that, not just in DHS, but everywhere. It's part of what we do. We ask about the water temperature, we ask about seat belts, and we ask about guns. We need to do that more, and we need to do it better, and we need to do it in a way that our families can hear it. And now we have the opportunity to do it with an item that they can take home to use to promote more safety. Thanks to this initiative, we will now supplement our education and provide gun locks and take this concrete step toward improving gun safety and protecting our children and their families. DHS is proud to partner with the Board of Supervisors, the Department of Public Health, and the Office of Violence Prevention in this great work. Thank you.
Thank you so much, Dr. Thine, and to the entire DHS team for this partnership. Next, it's my pleasure to introduce Dr. Scott, the Associate Chief Medical Officer and the Chair of the Physical Medicine and Rehabilitation Department at Rancho Los Amigos National Rehabilitation Center. Dr. Scott serves as the co-director of the Southern California Spinal Cord Injury Model Systems Project and conducts spinal cord injury clinical research. He has over 30 years of experience at Rancho treating patients who have sustained traumatic and non-traumatic spinal cord injuries. Dr. Scott?
Thank you, Dr. Ferrer. And thank all of you for gathering on this beautiful day at the Carlos Benavides Amphitheater on our beautiful campus. It's extremely important for us as healthcare providers to lend our voices to this very important effort to promote gun safety and gun violence prevention. Our doctors, nurses, therapists here at Rancho Los Amigos are all too familiar with the profound impact gun violence has on individuals, their families, and the community. And although unintentional gun injuries can and do result in fatalities, the vast majority of these individuals survive, but are often left with significant life-changing disability. Survivors will come to a place like Rancho to receive specialized care for spinal cord injuries, traumatic brain injuries, or multiple orthopedic injuries caused by a gunshot blast. These injuries can be devastating, resulting in paralysis of the arms and legs, cognitive impairment, loss of bowel and bladder control, and sometimes the inability to breathe on their own, requiring an individual to be on a ventilator for life. And then there's also an emotional and mental health toll on both the patient and family with these types of catastrophic injuries, as well as an economic impact for the individual, their families, and our community. Now, from time to time, I have the good fortune of crossing paths here on campus with patients who I treated in the hospital 25 to 30 years ago when they first had their spinal cord injury. And usually they start by saying something like, "Dr. Scott, you look exactly the same. You haven't aged a bit, except for a few gray hairs." But it's really gratifying for me during these encounters to hear how well they're doing at maintaining their health over the years. Despite the challenges of having a disability, many are in the workforce, have pursued educational goals, they're raising families, participating in adaptive sports and recreational activities, and living very fulfilling and independent lives. But I can't tell you how many times these same patients who have been successfully living with their injury for years will ask me, "Dr. Scott, is there anything new available to treat spinal cord injuries? Is there a cure for my paralysis? Is there a way to reverse the damage so that I can get out of this wheelchair?" Unfortunately, although we've made advances in neurological recovery and rehabilitation, the damage done by a gunshot blast to the spinal cord is extensive, and we still don't have a way to fix it. So that being the case, our best chance at managing this condition is to prevent unintentional firearm injuries from happening in the first place. Prevention, prevention, prevention. As Dr. Tyne mentioned, children and adolescents are often the main victims of unintentional firearm injuries. We owe it to them to protect this vulnerable population by promoting gun safety and promoting secure firearm storage. As Dr. Tyne mentioned, we already do this in our pediatric primary care clinics in DHS, with nurses asking survey questions related to gun safety in the home before each well child visit. Just as they ask about water temperature in the home to prevent accidental scalding, or the wearing of bike helmets or choking hazard, we ask about whether there is a gun in the home and if it is locked. Distributing gun locks in our DHS facilities is another step in the right direction toward prevention of these senseless injuries. So in closing, Rancho is very pleased and proud to participate in the gun lock distribution effort that is being highlighted today to further promote gun safety and gun violence prevention. We are the first DHS site to go live with distribution of gun locks. So once again, Rancho is doing our part, and we continue to lead the way. Thank you.
Thanks so much, Dr. Scott, both for your service and your important message today. Our next two speakers are survivors of gun violence. Survivors can be patients who survived gunshot wounds, or they can be an individual that's left with the grief of losing a loved one to gun violence. First, I want to introduce Rudy Nunez. Rudy has a spinal injury that he's had for 30 years. He lives with his mother and brother and enjoys family gatherings, travel, listening to music, going to movies, and much more. He says he's trying to be as independent as possible, and he's getting the most out of life. Rudy also works as a peer mentor for the No Barriers Department at Rancho, where he helps patients by sharing knowledge, experience, and resources. His goal for 2024 is driving, but I want to thank him for being here with us today and having the tremendous courage to share his story. Rudy, are you good coming up?
You guys hear me? Yeah. Yes, okay. Thank you. Right, there's my, thank you, yes. Yes, right there. Thank you for inviting me to speak today. My name is Gustavo Nunez. I am a Nobel peer mentor here at Rancho, and I am a victim of gun violence. The year was 1993 when I was 16. At the time, I was in a car with a friend, and someone shot us at our car. And they were in. Suddenly, my friend panicked and realized that I got shot in the neck. And suddenly, um, left in the car. I was in the car, left. I was in the car for a long time, you know. At the moment, I knew I was shot. I was trying to get up, but I wasn't gonna be able to move, feel my body anymore. I was losing my breath, and I was really scared, and I was screaming for help. I was just thinking about my mom, my dad, my brother. Then I started to pray, asking God, please help me. And when I finished praying, I just heard the ambulance. Like, thank God, you know. Once the paramedics got there, they put a neck brace on my neck. Sorry, I'm sorry. They put a brace on me, and they lifted me out of the car. Once I was in the ambulance, I kept telling the paramedics I was losing my breath. And so then they put an oxygen mask over my face. On the way to the hospital, I ended up passing out. I woke up with a breathing tube on my nose. After about 1 month in Martin Luther King Hospital, with a breathing tube and feeding tube down my nose, I was transferred to Rancho Los Amigos to start my rehabilitation. At Rancho, I was diagnosed as a C5, C7 incomplete quadriplegic, which means I'm paralyzed from my neck down. I couldn't do anything for myself. Throughout my rehabilitation, I started to see improvement. I would be able to breathe without help. They took the feeding tube out and started to move my arms. After 4 months of rehab, I was so happy to be able to feed myself some whole meal. To feed myself, you know, because it was hard for me to feed myself and stuff. And directing my care and, and transfers and etc. Throughout the years, I gained sensation and movement and feeling throughout my body. Thanks to rehabilitation services at Rancho. Everyone at everyone at Rancho really helped and gave me hope. Once I was more independent, I learned to take the bus, graduated high school and college, and I got my certificate on alcohol and drug counseling. That was my first job, being in a wheelchair. I worked as a counselor for 7 years. I was helping people to wanting to get sober. In 2016, I started volunteering at Rancho, and when I learned about the no barriers, I knew I wanted to be a peer mentor to help others with spinal cord injuries, and pay it forward. I help patients to apply for access to transportation, Elliott Health Portal, and given life experience, and many resources. I see patients when they return to their first appointment in clinic, and I also lead two SCI support groups, outpatient for spinal cord injuries. It means a lot to me to help people with spinal cord injury, to show them life is not over. There's still life after injury. I want to thank Supervisor Hahn, the Board of Supervisors in Rancho, for available to share this time to share my story and making these gun locks available to help stop gun violence. Sorry, gun violence.
Muchas gracias, Rudy. Thank you so much for sharing with us today. And I appreciate your courage. And I know that you've inspired all of us here. And I know that in your work, you're bringing hope to so many others. So, mil gracias por todo. So, and next, I want to introduce Mia Livas Porter, who recently joined us at the Office of Violence Prevention as our policy analyst. Mia is a gun violence survivor, a longtime Moms Demand Action volunteer, and a former candidate for the California State Assembly. She has created and led dozens of state, region, and nationwide trainings on gun violence prevention work, particularly on suicide prevention. And she shared her survivor story on television, podcast panels, and on the steps of the U.S. Capitol. For me, I just want to thank Mia. She and I met, I don't know where there he is. She and I met earlier, a couple of years ago, and bonded on this work that she's leading. And I just found out she's like now part of the team at DPH, and I'm so excited. Super skilled, but also has taken a story filled with much sadness and turned it into hope for so many of us. So thank you, Mia, for being with us today.
Thank you, Dr. Ferrer, and thank you, Rudy, for sharing your story. Good morning, everyone, and thank you for coming out today for our LA County Office of Violence Prevention, OVP, National Public Health Week press event and resource fair. My name is Mia Livas Porter, and I'm a mom of 2 boys, a survivor of gun violence, a longtime gun violence prevention activist, and a new member of OVP as a policy analyst. I didn't find my voice as a survivor of gun violence until 6 years ago when I joined Moms Demand Action as a volunteer. I always thought of being a survivor of gun violence as someone who had been shot, maybe in a street violence or was in a mass shooting. I didn't think that I qualified to be called a survivor because my brother Junior died by gun suicide over 30 years ago. I didn't think I had a right to grieve like my mom did, because I lost my sibling, not my child. And I certainly did not think that I had a right to share aloud one of the greatest traumas of my life, because my Filipino culture impressed upon me for the previous 25 years that I should feel shame and hide that my brother not only was schizophrenic, but had also died from gun suicide. But over the past 6 years, I have learned that every survivor story can make a difference. Our stories connect us. They inspire others to step forward and realize that they have a right to grieve, to want answers, to demand change, and that our stories can compel the government to take action with gun safety legislation. And the more I did this work, the more I realized it's our responsibility to share our stories if we as a country want to address this public health epidemic of gun violence in America. When I think of my family's tragedy, I think of my brother Danny, who found Junior's body and never moved past his guilt and his grief. I think of my dad, who died of a broken heart 3 years later. And I can still hear the wailing of my mother. But it wasn't until a few days ago that I realized how Junior's death impacted those outside of our immediate family. From the grief and regrets of his friends and extended family who knew and loved Junior, to those who adored and relied on my dad, a doctor who made house calls to his elderly patients, to even my own children who were generationally traumatized by the projection of my fears and anxieties. And that is why we need to speak out. We all need to understand that each of us can do something to help end gun violence. We all need to ask our friends and loved ones if they have a gun at home, is it securely locked? And especially when it comes to gun suicide, minutes matter. Data shows that if we can help someone struggling with suicidal ideation through 20 minutes, we could save a life. And since we know that 90% of gun suicides are fatal, it is our duty to share the information and the tools that can prevent gun suicides. Finally, it is our moral obligation to use our voices to create a world free from gun violence where we all can thrive in peace and security. Thank you. I would now like to take a moment to introduce our next speaker, whom I have worked with countless times over the past few years doing gun suicide prevention work, and has now become a dear friend, Sandry Kramer. Sandry is a member of LA County's Office of Violence Prevention Community Partnership Council. She has over 25 years of experience in suicide prevention and intervention and crisis center work, and Sandry is a founding member of the Los Angeles Suicide Prevention Network. Sandry now serves as the Director of Community Relations for Didi Hirsch, the nation's first and largest suicide prevention center and a leading provider of mental health and substance abuse services. It is my pleasure to introduce Sandry Kramer.
Thank you. Oh my God, that's such a nice intro. Wow, thank you so much. What a great introduction. Thank you, Mia. Thank you for sharing your story. I'm here to tell you that all deaths, near deaths, and injuries stemming from gun violence, whether they are suicides, accidents, homicides, mass shootings, are very likely to cause significant and at times intergenerational trauma and lifelong mental health challenges. And people with mental health challenges, in turn, are more likely to be the victims of violence. That is a cycle we have to stop. What's the connection to suicide? When we talk about gun deaths, gun violence, we actually tend to forget that the majority, and an estimated 54 to 57% of all gun deaths in the past 5 years were suicides. In 2022, we lost almost 27,000 people to gun suicide. And that in this country, that translates to one gun suicide death every 21 minutes. That is too many people. And I believe that gun suicides are especially heartbreaking because guns do not provide second chances. Yet we know that 9 out of 10 people who survive a suicide attempt do not go on to die by suicide. The vast majority of people change their minds, even in the middle of an attempt. But guess what? After I pull that trigger, chances of my survival, never mind me changing my mind, not likely to happen. That is why, especially when it comes to gun suicide prevention, we have to really put a priority on what we like to call means safety counseling, right? It means we got to keep our house safe for the times that maybe us or loved ones, or even just people visiting our home, may be going through a suicidal crisis. We don't want to give anybody easy access. Because again, tragedies can so easily be prevented, which is why, and I really like what you said, Mia, about it doesn't even take that much time for a person to go from acutely suicidal to seeking out the help they need and interrupt a potential attempt. We have to do that. That's also why Didi Hirsch provides our 988 counseling. This is a 24/7 hotline throughout the nation. Anybody can call that. So if you are a loved one and struggling with suicidal thoughts, please reach out to that number. And let's definitely stop this cycle of suicide by guns. Thank you.
I want to give a special thanks to Sandra because she's working so closely with us to guide the county's response. And I appreciate your leadership and thank you for speaking with us today. I'm now going to turn it over for our last speaker, which is Andrea Welsing, the director of the Office of Violence Prevention. She's going to give a very brief overview of the gun safety platform that we've developed with all of our community partners, and then I'm going to open it up for any questions or comments. So, Andrea.
Thank you, Dr. Ferrer. And I will be brief because I just thank you for all being here and for those of you sitting in the hot sun and those of you standing here. So I will try to keep it very brief, but I do want to share just a little bit. And before I do that, I want to echo Dr. Ferrer's thanks to the Board of Supervisors, especially to Supervisor Hahn, who put forth the Gun Safety Lock Board motion. Kyla has now joined as well as Julia, so she's there in the back. And so deep thanks. And then to Dr. Ferrer, because we could not do this without your support and your champion and your navigating the way for us to do this work. And it's not easy, it is hard work. And I am grateful also for the OVP staff, Patty, who did a lot to pull this event together and to make sure that the medical centers got their gun safety locks and bins, to the DPH staff, and then to our community partners who have just walked with us along the way and really guided our work. So I just want to say thank you because I don't want to ever take that for granted, the amount of energy and work that goes into doing gun violence prevention, intervention, and healing work. It takes a lot. So the Board of Supervisors established OVP in the Department of Public Health in 2019 and gave us the task our mission to strengthen capacity, coordination, and partnerships to address the root forms of violence and to advance practices and policies to address all forms of violence and to promote healing in all communities in LA County. In 2022, and with Barbara pushing to say after Uvalde, Texas, and Buffalo, New York, and the increasing numbers in homicides during the pandemic, we need to do something more, she said. Andrea, we need to do something more. And so we pulled together our county and community partners. They are the governance structure that guides our work and holds us accountable. And we pulled those partners together in 2022 to develop the Gun Violence Prevention Platform. It is a 40-point platform that outlines strategies to reduce violence and specifically gun violence in LA County. And the group, the task force that worked on this, identified 4 priorities. In addition to the work that we're doing in the office, we have a comprehensive set of strategies. We fully believe that you need that 3-pronged stool of prevention, intervention, and healing in order to address violence. It added new priorities for us to focus on that would really beautifully supplement that work. And that included promoting, looking at gun safety legislation and really doing our best to look at where there were opportunities to advance policies to prevent gun violence. To invest in social connection and healing locally and at the community level and in concert with our community partners. How do we create the safe spaces and the social opportunities for social connection and healing that's so vitally needed? Again, another board motion around, and an area that we were looking at in terms of raising and increasing awareness around restraining orders. It's a tool. Gun violence restraining orders and then subsequently domestic violence restraining orders. How do we increase awareness and about this as a tool and move forward that work so that people can know that those are tools that are available and to help them navigate the system if they choose to do that. And the last is the school safety initiative, where we are investing $5 million in 5 districts to really promote school safety and look at a variety of strategies there, including mental health supports for young people, so that we can reduce violence. So the gun violence prevention platform builds upon our existing work, added 4 new important priorities, and the gun safety locks are one more tool. And as part of that work, it is one tool. It needs to be paired with education. We want to distribute 60,000 gun locks throughout LA County. We are doing it with our DHS partners in their medical facilities. Subsequently, we will do it in county libraries with our county library partners. Our partners LA Care, our partners Los Angeles County Medical Association, all on board to help promote gun safety locks. Our partners LA Care and LACMA are also doing a billboard campaign. Our own DPH Communications is doing a communications campaign. You can start to see those billboards are already up, one along the 710, which I come up on. And so keep your eyes open for that. They're in areas where disproportionately impacted by gun violence. So we're really happy about that and the partnership there. Last thing that I'm going to say, gun violence is preventable. You heard that over and over again today. It is really preventable, and we need to do everything that we can in our power to prevent it. But we cannot do this alone, and everyone here has a role to play in that. You know, we all can play a different role. We all can have a different piece, but making sure that if you own a gun, it is securely locked and stored away from your ammunition is an important piece of that. But also, if you go to our website, and that was given earlier, you can find other ways to be involved with the platform, find where there are local community efforts that are building coalitions around gun violence prevention. You can find out where there are other resources. Many of the community-based organizations here are listed on our website, and they have additional resources for you, how to talk to children, where to get information, how to get involved civically and vote, use your vote to prevent gun violence. So I encourage you to go to our website. I just want to thank you for being our partners. Thank you for being here today. Thank you for those who gave their voice and their stories, Mia and Rudy. We appreciate you all, and thank you. I'll turn it back over to Barbara.
Thanks so much, Andrea. And just before we open for any questions, I do want to say, you know, I started my comments by saying how sad I was, but I want to end my comments by saying how hopeful I am. And I'm hopeful because of what we just all heard here today. You know, I think it takes a special group of people, and I think they're all here today, to make a huge difference on an issue that matters to everyone. So I want to thank everyone for providing us with hope and, more importantly, a path forward. With that, I'll open for any questions from the press. Questions? Okay, so we have a wonderful resource fair. So, oh, is there a question? Sorry. Yeah, go ahead. Yeah. Yeah, so we only have preliminary numbers for 2023, so I don't want to speak definitively about 2023, but we did see an increase in gun violence related events in 2022. You know, I always caution people on looking at just 1 year in isolation of it, by itself, because what really is important to look at trends over time. I do think, unfortunately, though, with more access to guns, more people having guns, we're going to see increases in gun violence without us really working hard together to really promote gun safety. I mean, I started by saying, you know, our platform obviously includes requesting a ban on certain kinds of guns that we think have no place in anybody's house or in anyone's community. But the reality is, with 400 million guns in this country, more guns than people, we have to focus on making sure everybody knows about gun safety. That if you do have a gun, then we need to help people be responsible for limiting that gun's use to nonviolent purposes. So yes, I mean we're happy to share sort of trend lines with you. I can have our team sort of share that, but the 2023 data is very preliminary at this point. So, thank you. Other questions? No? Okay, thanks, Brett. I want to give a big thanks to our communication teams also. The busy week for them. We do have events all week, just highlighting the amazing partnerships across the county to promote health and well-being. I thank our partners. Particular shout out to the folks at Rancho for welcoming us and allowing us to be in their space today, and all the wonderful people we met while we were here. But there is a resource fair. There are some